And this just in, bigger isn't better. We've got the details on what's hot and what's not in plastic surgery, procedures for the summer, and Dr. Roth has a lot of explaining to do. At 7:41, we'll be right back.
Welcome back to Fox 5 News live in Las Vegas on this Friday. It's 7:43. Okay, people, there is a new trend in plastic surgery, and bigger isn't necessarily always better. Here to explain what's hot and what's not this summer is Dr. Jeffrey Roth with Las Vegas Plastic Surgery. So things are always going in and out of fad with style and also with plastic surgery.
Absolutely. What we've been seeing lately is less of the big ticket items, less of the blue plate specials, the facelift, brow lift, that sort of thing. And people are pushing that off and are doing Botox and Juvederm, things to kind of get them by over the next few months until they feel a little bit more comfortable financially, and then go in for the big ticket item.
Because like we're saying, this is kind of recession-proof business, but not really, because some of the procedures are more expensive than others, but people still want to have their upkeep and feel good about themselves, so they might opt for some of the smaller procedures. What's really hot right now? Well,
what's really hot right now are the smaller procedures, the Botox, the Juvederm, and what's new in plastic surgery is this stuff called Latisse. What it is, it's a medicine that grows eyelashes like crazy.
Yeah, I've heard about that.
Yeah, it was actually a drug for the eyeballs for glaucoma, and they found these little old ladies were growing eyelashes like crazy. They figured out what it was, they went through the FDA, and now it is available at the plastic surgeon's office or other doctors in town, and they think it's going to be bigger than Botox.
Wow. Okay, how much would that run you, Latisse? Because everyone wants great lashes. You don't have to wear mascara maybe if you've got naturally great lashes.
Right. It ranges throughout town. We've called around, and usually it's between $120 and $150 for a month's supply.
And you see some results in a month?
Oh, absolutely. You get longer in 1 month, you get thicker in 2 months, and darker after that. So the statistics, the study shows 25% longer, 106% thicker, and then darker after that. So it's crazy.
Oh my gosh. And also, too, there's no real side effects, right?
No, there may be a little bit of itching, there may be a little bit of redness, and that's about 1%. And that's in anything.
Very minor, yeah.
Anything you put on the body, you're going to get that sort of statistic. But then usually, if you leave it alone, it'll calm down, you can go back to it again.
People love that. Who doesn't want good long lashes? It's always the boys who get them, not the girls.
That's what I hear a lot.
It's always the baby boys with those long lashes. Okay, let's talk about breast augmentation. In Las Vegas, that's a huge surgery.
We do that often.
You think? Once or twice, right?
Yeah, we do that once in a while.
That's changing a little bit, though, isn't it?
Yeah, it is. Basically, it comes down to the individual. Some people want big, some people want less big, some people don't want anybody to know, some people want them out there, just like anything else. But typically here in Las Vegas, we've seen a little bit of a diminution instead of going crazy big to kind of ratchet it down a little bit. The most common size that we get requests for is usually a full C/small D, which I think looks good in a swimsuit, an evening gown, or a costume at work, but still it's not, oh my gosh, look at that girl.
So sometimes less can be more, right?
Yeah, kind of like a whisper instead of a shout.
And also, too, like you're saying, with the Botox and Restylane, these are small things you can do to instantly feel better about yourself for a weekend or for an event without the huge price tag of maybe a full procedure.
Absolutely. I think that's really the driving force lately of why more and more of these things are becoming more and more popular. Very little to minimal downtime. You get to see a result right away, and it's less expensive. But people have been telling me, this is great for now, Dr. Roth, but I'll be back to do my procedure when everything starts rolling again.
And it's not just the girls, it's the guys too.
That's true. About 10%.
Thank you so much for your time. We really appreciate it.
Absolutely.
All right, Jason, what have you done lately?
I just MySpace with Dr. Roth. I don't get any procedures, not yet at least, but it's coming.
That hair's real?
Thanks, guys. Just rolled right past that.